From the Toronto Star, I'm Saba Itazaz, and this matters. In Alberta, the second wave of COVID-19 is troubling. Cases are rising and outnumbering provinces such as Ontario, despite having only a third of the population. And Premier Jason Kenney finally said yesterday he means business.
And that is why I am declaring a state of public health emergency in Alberta. We are also announcing a series of targeted measures approved by the COVID Cabinet Committee based on recommendations from the Chief Medical Officer of Health. These mandatory measures will place new restrictions on social gatherings, worship services, businesses, schools, and all Albertans.
But until yesterday, despite the COVID-19 numbers, Albertans were free to dine out, shop, and gather in groups, even as Ontario went into lockdown and other provinces tightened restrictions. Many health experts are concerned now that the current provincial measures are a case of too little, too late, and nothing short of a lockdown will help bring the infection surge back under control.
You ask, why aren't we taking even more stringent measures? Alberta is not involved in a chase after zero because, in our view, the broader consequences for the health of our society would be intolerable.
So on today's episode, Alex Boyd joins me from the Star's Calgary Bureau to talk about what's going on in Alberta, what the new COVID-19 restrictions look like, and what a potentially balancing act of politics and a pandemic could mean for Albertans. Hi, Alex. Thanks for joining me today.
Thanks for having me.
Alex, give us a sense of what's been going on in Alberta, especially before these new measures were announced. There's been such a complete contrast with so many other provinces navigating their COVID-19 second wave. Why is that? There's been a lot of talk about how Ford has handled it here and how Premier Kenney has handled things in Alberta.
Right. And I think to just kind of give a sense of how it's felt here in Alberta, I think a lot of people have really been watching the COVID numbers with a real sense of trepidation. We've been on an upswing for a while. You know, when you look at the numbers per capita, we've been outstripping Ontario for quite a long time, a few weeks now. But over the weekend, we hit a milestone that I think made both Albertans and people across the country really sit up and take notice of what was happening here, which is our daily total for the very first time was more than Ontario's. And so to put that in context, Alberta's population just under 5 million. Ontario has 3 times the population. But on a day-to-day basis, Alberta is now starting to sometimes see case counts that are higher than that. So I think that really kind of put Alberta on the map in terms of a part of the province that is really starting to see a lot of spread of COVID. And as you mentioned, you know, the way Alberta has reacted has been very different. Up until yesterday, we haven't seen any sort of new restrictions or new rules since November 12th. That's when the province brought in some tweaks to restaurant times, the time that bars could serve alcohol until. So we saw a few tweaks made on the 12th. Haven't seen much since then, haven't seen much of Kenny since then. And ever since, you know, our case counts have really started to rise. And so I think there was a real sense of things are starting to get a little out of control here. And it was time to see some action.
And now Premier Jason Kenney has announced some pretty seemingly drastic measures. So tell me more about that and how those are going to be implemented. When he's talking about a public health emergency, what does that entail?
Right. And so drastic might be a bit of a stretch when we describe these measures. He did put in what's called a public health emergency. So that gives the province new powers, essentially, to deal with a public health crisis. But when you look at actually some of the restrictions that we're talking about, they're not very restrictive, for lack of a better word. And that's intentional. Kenney has been very clear. He doesn't want a lockdown. It's very important to him that the economy stays open, that businesses stay functioning. And so he wasn't going to lock down Alberta. We heard him say yesterday he did not get into politics to put more rules on people. And so we're really seeing that reflected. So some of the rules that are a little bit stricter, for example, older kids in schools are going to go back to virtual learning for a few weeks. We're seeing a new mask rule, though it's only in Edmonton and Calgary, and frankly duplicates a lot of the work that those cities did months ago. The cities here have been a little bit more proactive. But some of the other stuff, you know, for example, indoor dining is staying open. Casinos are staying open with restrictions. Bars are still open with restrictions. So there are new restrictions. I should mention, too, that personal gatherings are no longer allowed in the province. That was a recommendation before, but now it's an official rule. So we are seeing some new rules. And I think certainly all of us here hope that has an impact on spread here. But it's frankly not as restricted as, say, what we're seeing in our neighbors in Manitoba or frankly in Ontario.
Right. And some observers have been talking about there's a sort of confused messaging into the restrictions as to what's open and what's not open, just like you're talking about. And a lot of people are also saying it might be a case of too little, too late. Would anything short of a lockdown help at this point with the kind of numbers and situation you're talking about?
I mean, certainly, I think there's still a lot of debate about how you control the spread of COVID. We're 10 months into this, and I don't think anyone has a magic answer of how you control it. But I've spoken to a lot of doctors who are feeling very worried right now. They've looked at the projections. They looked at numbers that show that a lot of hospitals, particularly in Edmonton and Calgary, are already operating over capacity. And they're really worried about what's coming in the weeks to come, particularly ICU numbers. The number of people who are hospitalized, the number of people who are needing that specialized care are on the rise in Alberta. And they're really worried that, within a matter of weeks, that system really could be teetering on the brink.
And does that kind of speak to, so far we've seen a sort of confrontational approach building up between Premier Kenney and health experts. You're saying Premier Kenney is trying to do this sort of balancing act. Meanwhile, health experts for a long time have been calling for a circuit breaker lockdown. So this kind of shows how this relationship has been progressing so far.
Right. And there's certainly a divide emerging between how Kenney sees this and how a lot of health experts see this. We saw dozens of doctors in Alberta 2 weeks ago now pen a letter saying, yeah, we want a circuit breaker. And that is what's kind of become known in other countries as kind of a sharp, hard lockdown that really curbs the spread of COVID and buys the healthcare system time. But what we've heard from Kenney, he's much more concerned about personal responsibility. That's something that we've heard from him a lot. He wants people to do their part. He wants people to kind of take action to curb spread, but he's been very, very reluctant to put in actual restrictions. And I think that's really a reflection of who Kenney is. We know Kenney, obviously he's a long-term conservative. He was a minister in the Harper government. This is not his first rodeo. This is not a guy who doesn't know how to handle big files, but he is someone who believes very strongly in the role of small government. He doesn't believe in restrictions. We've seen this from him time and time again. He's quite open about this. But it's interesting, for example, if you look at the comparison with Doug Ford. So the two premiers, they were elected around the same time. They're both conservatives. So people do tend to draw the comparison between the two quite often. But the experts that I've spoken to have really said that the pandemic has teased out the fact that they're really quite different. Kenney is very ideological. He's very strategic. He's really committed to this idea of small government. Ford, on the other hand, is, I've even heard the word intuitive, a little bit more responsive, pragmatic to describe him. And to be clear, I know a lot of the listeners of this podcast are from Ontario. They're probably listening to this and saying, Ford's not perfect either. And I absolutely hear that. I know there's been criticisms of Ford. But just to give you some sense of what the view is like here in Alberta, I think a lot of people are looking east and saying, hey, this guy shows up. He goes to a press conference most days. He answers questions. Good days, bad days, he takes that response. Whereas, Kenney's been a much smaller presence here. Up until yesterday, we hadn't seen him speak at a COVID presser in 11 days. He hasn't spoken much publicly about COVID at all. So it's just a very different response that we're seeing from the two premiers.
Interesting, you should bring that up. I was reading that in your piece about this as well, what is considered a hands-off approach by Premier Kenney. And early this week, there was a hashtag where's Kenney, that was also trending on social media. Is that the general perception, like there's a perceived disconnect in approaches here?
It has. And, I do want to be clear because I think some people have seen this as people kind of hounding Kenney to put in a lockdown. And again, there's a debate about how you curb the spread of coronavirus. But I think the overarching point here is that whether or not Kenney wanted to put in restrictions, whether or not he didn't, the overall strategy just really hasn't been clear. And again, I really think it's worth reiterating that Kenney is a very experienced politician. He's been known as kind of one of the hardest working guys in politics. And so for him to just kind of take a back seat is very, very uncharacteristic for him. And so I think a lot of people have just kind of wanted answers, and when you look at, for example, the information that's been available to Albertans, BC, for example, has released a lot of pandemic modeling. Alberta hasn't seen any since May. Ontario right now is having, a big debate about what the thresholds for lockdown should be. And are they low enough? And is that correct? And is this how we should be doing things? In Alberta, we're not sure what kind of numbers would justify further action. So there really just has been much less information available to the public here. And Kenny just, has been much less of a presence. I think there's just been, a hunger for answers.
We'll be right back. And even yesterday, he spoke about civil liberties and saying that Alberta isn't involved in a chase after zero. What does that mean exactly in terms of his approach now with the situation where it is? Does it feel like it will be more of the same?
Right. And Kenny, is someone who has a fundamental belief in individual rights. And, I've spoken to a lot of experts who say Alberta has traditionally been conservative. We had a conservative government for 44 years, but this is very much a different flavor of conservatism that's starting to emerge in Alberta. It's not kind of the collectivist, responsible to the group conservatism that existed in Alberta for decades, that we see in Ontario, that we see in Atlantic Canada. It's a much more individualistic, competitive form of conservatism. That's really what we're hearing from Kenny. Kenny has been criticized for not showing the emotion and seeming to feel the pandemic in the way that Ford seems to. We saw him push back against that a little bit yesterday. He listed all the people that he's spoken to. And one of the people, he talked about meeting was a refugee from Venezuelan socialism, as he put it, who had put all her money into her business in Calgary and, was just really, really worried about further restrictions on businesses here. So, to be clear, none of the doctors I've spoken to are not worried about businesses, but really that idea of business, the idea of the marketplace staying open is something that is very important to Kenny.
And there's some more questions I have around this, like while the provincial governments need to try as much as possible to not negatively affect the economy, might be understandable, there has been a lot of hesitation to even put certain measures like mandatory mask policies in place, which would have had no impact on the economy, right? Why is that?
Right. And to be clear, Alberta is, I think, now the last province without a masking bylaw. And so this is something that they've been very resistant against. And again, I think this is a reflection of this idea that they believe in freedom and believe in individual rights. To look at this, favorably, to give them some credit, most of the COVID cases thus far in Alberta have centered in Edmonton and Calgary. And the municipal governments here, which have been much more proactive with this, have put in masking bylaws. So we haven't seen as much spread in the rural areas. Of course, that's where a lot of the conservative base is. But you could say, masks were maybe not as needed up until more recently. But again, we're starting to see that spread pick up in rural areas as we see cases rise. It is starting to hit other parts of the province that haven't hit previously. So again, I think the UCP are kind of in this position of trying to balance, their rural conservative base who really believe in, those individual freedoms with trying to kind of put in some sort of measures to curb the spread.
And Alex, what have been some of the biggest logistical challenges in dealing with COVID-19? The breakdown of the contact tracing system is also a big hiccup in the system, right?
Yes. And so, Alberta, to give them credit, had a lot of successes early on. They were a leader in testing. They were a leader in contact tracing. They were actually the first province to roll out their own contact tracing app. But we've really seen a lot of this collapse in recent weeks. Dr. Adita Hinshaw, our chief medical officer, has said that contact tracing, they're overwhelmed. And so this week they actually had to say, you know what, we're giving up on the backlog. We're focusing on more recent cases, which means there's a whole chunk of Albertans who, got COVID, 10 days ago, 2 weeks ago, and didn't have access to the service. The other thing that's really been a point of contention here in Alberta is the contact tracing app. So Alberta released this app very early on. Kudos to them for that. However, it didn't work on iPhones. I have an iPhone. I downloaded it. I couldn't be outside of my house for longer than 5 minutes without it draining all my battery because it had to work in the foreground. Someone also, actually asked for the numbers a couple of weeks ago. And it turns out this app, which costs thousands of dollars, has only been used used for 19 cases so far. So it's basically isn't working. At the same time, there, of course, as you know, in Ontario, there's a federal app. It's available to us. We hear from Trudeau constantly that he wants people to download it, to use it. But Kenney has refused and said, nope, we've got our own. We don't need it. But even in the face of evidence that it's not working super well, they continue to defend it. And that's certainly been a big source of frustration, I think, for a lot of people.
And does the public perception also kind of reflect the provincial approach to dealing with COVID-19? You already have been talking about this, but does Alberta's political culture have something to do with the way this crisis has been navigated? And does public perception also support that?
I would say the political culture here has informed the response. Obviously, Alberta does have conservative roots, though, like I say, I would argue that form of conservatism is shifting a little bit. But again, there is, a respect for business and a respect for individual rights here. I got an email from a spa owner in Fort McMurray this week who, is very clear that, a lot of people don't understand how small business owners are struggling. And I think that's probably true. But at the same time, I think we're starting to see a divergence from Kenney's ideology and how Albertans are viewing it. A recent poll found over 3/4 of Albertans support a province-wide mask mandate. Another recent survey looked at kind of general satisfaction with COVID response, and over half of Albertans are either somewhat dissatisfied or very dissatisfied with what the province is doing. So I think there is, growing dissatisfaction with what's happening here. Kenney, tends to kind of stick with his ideology, stick with what he thinks is right. And so, at what point do we start to see that, diverge, or, maybe some of these measures start to get some traction and people start to buy into the province's plan a little bit more? That's kind of what remains to be seen.
And we've all seen and learned that the provinces that kind of acted early and hard have so far been doing much better in the second wave of the pandemic, like, for example, the Atlantic provinces. What are experts predicting for Alberta in the coming weeks? Are we looking at a grim December if things don't turn around soon? And what's needed now to kind of bring that turnaround?
Right. And certainly, I think a lot of people in the West are looking at Atlantic Canada maybe a little bit wistfully now. I think they got on it early. Again, now that there's this level of spread in Alberta, there's definitely a lot of debate about what further measures should look like. But certainly the doctors that I've spoken to are worried. When we've got hospitals that are already operating at over what is supposed to be their maximum capacity, that's certainly an issue. I've spoken to a lot of healthcare workers that are feeling tired. They're feeling stressed. They feel like, we had this situation in the spring where people were very supportive of them, but they're in this position now where they don't feel supported. They feel like the provincial government does not have their back. So I think a lot of them are in a tough position as well. So, taking that together with where the numbers are at and with what I think a lot of medical professionals feel are not particularly stringent measures introduced yesterday, I think a lot of doctors are quite worried about the weeks to come. Things could get pretty tough here in Alberta.
Thank you so much, Alex. It's always great to have you on, and stay safe out there while you're doing your reporting.
Thank you.
I was talking to the Star's Calgary-based reporter, Alex Boyd. That's it for today. Thanks so much for listening. This Matters is hosted and produced by me, Sabai Tazaz, Adrian Chung, and Raju Mutter. Produced and mixed by Sean Pattenden, and our director of programming is JP Fozo. Our show theme music is by So-Called, and our episode music is by Mike DeAngelis. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.